That's good.
Hello, I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we are talking with Kylie Williams, who is a NICU supervisor at Blank Children's Hospital. One of the reasons that we're talking with her is that the NICU is celebrating their 50th anniversary this year, which is super exciting. So Kylie, what can you tell me about what sets the Blank Children's Hospital NICU apart?
Yeah, so well, like you said, we've been a NICU here in Des Moines and part of Blaine Children's Hospital for 50 years. And through that time, the changes the NICU has seen would be, I mean, shocking. Where in the very beginning, we kind of had that typical setup that a NICU had, where it was an open room and our isolates and our warmers were kind of lined up in a row, so all open NICU style. And then actually in 2000, I believe, we were the first NICU in the country to open a unit with individualized patient rooms. So each of our patients or families as a whole would have their own private space for, increased bonding with their baby, a quieter environment for growing, and just an overall, it was the forefront of really changing the way NICU was developed. Now, since then, all of the other models of throughout the country have kind of replicated that idea. And, we're kind of having plans in the future of what our next style of NICU will look like when
Sure.
we're continuing to grow. So
That's exciting to know, as parents and families in Des Moines, that we have access to that, high quality and forward thinking services. So what kind of patients, like ages and conditions, do you see in the NICU?
So it's really a variety. So right now we will support babies who are born prematurely at 23 weeks all the way up to term. And so it's kind of anywhere from prematurity to babies who come out and have, I think that you often hear babies will have their first bowel movement inside mom and have a meconium. Sometimes that can make baby very sick and need a little bit more help with this. And also just other complications and delivery that can result in baby needing some help. We are probably in the near future going to also expand our practice to take care of babies who are born even a little bit earlier in that 22-week range.
Wow, that's amazing and a great peace of mind, I think, just for parents who, are still expecting that they have those services available to them. What can you tell me about the staff that, really sets the NICU at Blank apart?
Well, we have a great multidisciplinary team. So, and that's just all around. So, our neonatologists, our practitioners, our residents who are in the pediatric residency program, our child life specialists, nutritionists, it's just universal. And then our robust nursing team. We have a very large nursing team because we have a big NICU. So, and our nurses have been here from upwards to 45 years. So we have brand new nurses who are just graduating from college up to these 45 years of experience. And so that is unique in the nursing world today. Most of our nurses find that once they get here, they love it and they spend their whole career here.
That's great. And I think that says a lot about the care and the service that you offer. No parent wants to end up in the NICU with their child in the NICU. What tips do you have for keeping your kids healthy to avoid that?
Yeah, so I want to start by saying that most of the time when moms have a complication that results in a baby coming to the NICU, it is really outside of their hands, whether that be, again, that event that happens in delivery that requires the baby to come to NICU, that prematurity, oftentimes those are often out of her control or both the parents' control. So I think that the important thing is just to maintain those regular checkups with your OB provider, um, just those staples of a healthy diet, talk to your provider if you have any concerns throughout your pregnancy so that they can kind of start to pinpoint those things sooner than rather than later to get you the help that you would need to hopefully get you to closer to term if you were to deliver preterm. And, some of those events that take place at delivery, again, they are out of a mom's control. You never know when you can't control your baby having that meconium. Because sometimes having a baby is hard. It's stressful on your body, it's stressful on baby's body, and it's just kind of how delivery works sometimes.
I think that's great advice for moms, just to not be so hard on themselves, which
Yeah,
is hard as a mom. I know
absolutely.
we're hard on ourselves, but
We are our own worst critics.
yeah.
So, one thing that I'd like to kind of point out is if you do have a NICU baby, there are some things that you can go ahead and do once you go home to try to prevent further readmissions. And so these babies are often a little bit more sensitive, or we can kind of call it immunocompromised for a
Sure.
little bit more time than maybe your typical newborn baby would be. So just doing those extra precautions once you get home of good hand hygiene, limiting visitors, especially visitors who maybe have those sniffles and coughs and things like that, and then try to avoid those big crowds with your preterm or baby who was in the NICU.
Sure. So if you do have a child who is in the NICU, what can you expect as a parent? I know you already mentioned that you have the individual rooms. Are parents
Sure.
able to spend the night? Can you have visitors? I'm sure that there are limitations there, but what
Yeah.
does it look like for a family?
Yeah, so our parents are able to stay 24/7 and they can come and go as they need to. And what it looks like to be a parent of a first-time baby is way different than what it is if you have other babies at home. So sometimes that balance between NICU and home can look a little bit different based on what your family dynamics are and also where you're at in the state of Iowa. So we don't necessarily just take care of babies that are born here at Blaine Children's Hospital. We
Mhm.
have a specialized team that will go to our partners in the community and stabilize babies and bring them back. So sometimes we have families that live 2 hours plus away.
Mhm.
So we like to support them. They can stay here if they need to, but we appreciate that there's some limitations. There's also Ronald McDonald House that's nearby that they're welcome to stay at.
Sure.
As far as their other visitors, I don't want to kind of cookie cutter us into one staple because
Mm.
as we know over the last couple of years, we've had a lot of variations in what our visitor expectations are. Right now, we do have some visitor limitations. They're from the daytime, so 7 a.m. to 8 p.m. Families can have visitors that can kind of come and go to the parents' discretion. Right now, we have limitations, unfortunately, with siblings. We can only have people 16 years and older, just due to, unfortunately, those little kiddos are the ones that like to spread germs a little bit more.
Yes.
So,
Yeah.
so that has been really hard on our family. So that could change in the near future. It's just hard to predict what it is.
Right. Well, I
Yeah,
think it's so comforting for parents to know of the
mhm,
services and the care that they will receive
yeah,
if their children should have to be in the NICU at Blank
mhm.
Children's Hospital, that they really are receiving the best care and the best attention to what their child needs.
Absolutely. We do our best, and part of that team is also partnering with our social workers who are,
Mhm.
they're able to do some extraordinary things for our families who are having struggles to go ahead and help get them here. Maybe if it's um, a barrier for driving due to gas, or
Sure.
maybe coming and staying at Ronald McDonald isn't available. So we try to do what we can so we can have our families here with their babies.
Well, thank you so much, Kylie. We are excited
Absolutely.
to share the services from Blank Children's Hospital and to celebrate the NICU.
Yeah, absolutely. Thank you for having me.
Yes, thank you.